Pain is minimized after the penile implant procedure by staying in bed, ice, and by taking pain medication. I like to have patients on continuous pain medication of ibuprofen, which is anti-inflammatory. Patients take 600 milligrams 3 times a day, every 8 hours. Dovetailing with the ibuprofen, especially for the first 2 nights, patients can either take Tylenol with codeine or Percocet. All of these medications are prescribed in advance during the preoperative visit. We want to minimize the use of narcotics. Narcotics can make you constipated, and to mitigate that, we have patients take Colace twice a day, starting the day after the procedure, as well as milk of magnesia if a BM, bowel movement, does not occur 2 or 3 days after the procedure. In general, most of the pain occurs during the night of the procedure and the day after the procedure. After that, pain is markedly decreased to the point where patients can begin to deflate their devices on the 3rd day. Swelling is minimized by staying in bed and ice. So really, for the first 48 hours after a penile implant, a patient should stay in bed as much as possible. For example, if a patient has surgery on a Friday, we want the patients to stay in bed Saturday, Sunday, and then on Monday they can begin inflating and deflating their devices, and they begin to walk around a little bit more. But really, stay in bed, ice, it is really worth it. It will minimize swelling and will enable the patient to find the pump much more easily and to have less pain and swelling post-operatively. The incision is closed with non-absorbable sutures and then glued. So there is really nothing for the patient to do regarding the incision. The reason we use this technique is to allow the patient to take hot bath after the surgery. So on the 3rd day after the surgery, taking a hot bath is extremely soothing, takes away pain, swelling, and inflammation. And during the hot bath, you sit there for about 30 minutes. You begin to feel for the pump and the deflation valve, and then you begin to inflate if the deflation valve is actually palpable. The hot bath are not sitting. It's really supine, lying down. You want to reabsorb whatever swelling has occurred. So the strategy is ice for the first 48 hours to prevent swelling, and then heat after that to facilitate the removal and the dissipation of swelling. Some physicians advise patients to pull down the pump. That is totally, in my opinion, unnecessary and unsuccessful. Patients usually are very tender after the procedure, so even if you ask them to pull down the pump, they will not do it. So what's important is precise positioning of the pump in the scrotum, and this is better obtained with a infrapubic with a penoscrotal incision, the incision below the penis, and so in my practice it is not necessary to pull down on the pump in the scrotum. Colace is a medication, a stool softener. You should take that twice a day, 2 in the morning, 2 in the evening, starting the day of the procedure, and then milk of magnesia if a bowel movement doesn't occur after the 2nd day after the procedure. It's important to avoid constipation. Pain medication causes constipation. For the first 2 days after the procedure, patients should not do any lifting. Patients should really stay in bed. On the 3rd day, they can begin bathing in a hot bath. You can begin movement as tolerated. Patients are able to lift a moderate amount of weight for the first 7 days. We want to avoid displacement of the reservoir by lifting heavy weights and straining. However, there are very few restrictions after 7 days. Heavy exercise should be limited for the first 2 weeks. Patients can drive as early as 3 to 4 days after the procedure. You can return to work as early as 5 to 7 days after the procedure if your work involves sitting at a desk. If you your work involves a lot of physical strenuous activity, you should wait at least 10 to 14 days. Again, driving, important. Do not take any narcotics such as Tylenol with codeine or Percocet before you drive. If you need to take any medications, limit yourself to anti-inflammatories such as ibuprofen. By the third week, patients are comfortable enough to begin sexual activity. Some patients will need to wait a little bit longer, anywhere from 4 to 6 weeks. By the second month after the procedure, patients should no longer feel that there is a device inside their body. By the third month after the procedure, patients feel very, very normal. They don't feel that there is a device inside the penis, inside the scrotum. They can sit, they can do anything that they want to do without having to rearrange themselves. I request that all patients call or notify us if there is a lack of progress. So for example, if a patient calls and has pain 7 days after the procedure, the first question that I ask is are you better? Have you improved? Is the pain less than 3 days ago? If they say yes, then you know the patient is doing well. It's not the absence of pain that we're looking for, but it is an improvement of the condition. So lack of progress is really what I want to be called with. Increasing swelling, increasing pain, fever, patient should of course call. But the first symptom of a problem is really lack of progress. So a patient is not feeling better. And again, that's very, very rare. Occurs in less than 1% in my practice, less than really 0.5%. For the patients that live locally, we like to see the patient 14 days after the procedure. If they're inflating and deflating their implant well by then, we then recommend a follow-up visit 3 months, 6 months, and 1 year after the penile implant. Patients are then followed on a yearly basis depending on individual preferences. Patients that are travel patients, patients out of state or international patients, we actually do not prescribe any follow-up. The last time that I see these patients is sometimes in the operating room. Patients that are out of state that have their procedure on Friday, for example, I will see some of these patients on Monday morning. After they learn how to inflate and deflate their device, they actually fly back home. All the international patients fly back and there's no follow-up needed. If there are sutures to be removed, they can be removed locally. Sometimes the patients will remove their own sutures. Sometimes the patient's wife will remove their sutures. So there's no need for follow-up. Approximately 50% of our patients are either out of state or international, and we provide ample instructions, including instructions on how to remove the stitches if they do not want to come back. The earliest that I recommend that one uses the implant is 3 weeks after the implant procedure. We want the incision to be fully healed so that there is any exchange of bodily fluids. There is no infection at the incision site. Patients may still have a little discomfort in the penis. You may take an ibuprofen maybe 30 minutes before anticipated sexual activity to reduce the pain. Eventually, the pain will completely resolve. In the beginning, when the cylinders are fully inflated, these cylinders become extremely hard, harder than an erection when the patient was 18 years old. And so those patients may have a little bit of pain when the implant is fully inflated. You do not need to fully inflate it that much for the first couple of times that you have intercourse. So you can dial down the rigidity. Also, the partner may not like the erection to be that hard. It's at the couple's discretion how hard the implant is inflated. But you can start using the device as early as 3 weeks, and then you can use it as much as one wants. Any questions, any concern after the procedure, please do not hesitate to contact my staff, either Sylvia, Janice, or Ruby in the office, or you can contact me on my cell or by text as well.